Welcome to Forum 360 with its global outlook and local view. I'm Ardith Keck, host today. We're going to talk about travel. We're going to travel, actually. Coronavirus has spread worldwide, and we are pleased to have the former Director General, the Center for Emergency Preparedness and Response of the Public Health Agency of Canada, Dr. Ronald St John. Even though he's now retired, Dr. St. John is interviewed by the Canadian media almost daily about COVID-19. He is an expert in the behavior of infectious diseases and the public health response to them. Dr. St. John, how well has the government of Canada handled COVID-19?
Well, I was once asked to give it a grade, and I gave it a B plus, but now it's a C plus. We have a system here in Canada similar to the United States in the sense that our provinces and territories are primarily responsible for health issues. The federal government is not involved in health issues except for a few special areas like quarantine and control of the borders. As a result, there's been a lot of difference between provinces as to how things were handled. And a lot of it has been what I would call kind of a yo-yo phenomenon, in that because of the concerns between the economic impact of COVID and the health impact of COVID, politicians have tried to balance the two off. So the cases go up and everybody tries to shut everything down. And the cases come down, and as soon as possible, they try to ease the restrictions in order to help the economy. And the next thing that happens is people say, oh, things are better now, and the cases go back up and down. And so we continue to experience that across the country.
How well has the population reacted to the government and what they're doing?
Well, the population is tired. I think there is a lot of fatigue in the population, and part of it has to do with this up and down phenomenon. I've been a little bit concerned because when the authorities put in place restrictions, when the cases get to a certain level, they usually say we're going to have these these measures in place for a certain period of time, like to the end of May. And then the population wonders, well, what's going to happen at the end of May? I wish that they would say, no, we're going to have these things in place until the number of new cases per day is 0 or 10 or 100 or whatever the number is. Then people would know we're going to be under these restrictive measures until that point. But there is a reluctance to set those goals. And so I think the population is a little bit fatigued by, we open the restaurants, then we close the restaurants, then we open the gyms and we close the gyms. And I think people are tired.
Yeah, makes sense. And that's certainly true here in the US. Do you wear masks in Canada?
Yeah, absolutely. Although there's some backlash to that too at the present time. We tend to favor use of masks in many, many settings. Although outdoors, there's, if you, for example, wish to go for a jog or a walk outdoors, in most jurisdictions in the country, it's not necessary to wear a mask. Anytime you get together with people, and in some jurisdictions, this means outdoors also, then you are asked to wear a mask. And I think there's a lot of compliance with that request.
Do people actually do it? I know in the US, we have a lot of people who say, I'm not going to wear a mask.
Well, there are always some people that resist. And we've had a couple of protests, small protests in various cities against the use of masks. But in general, kind of a personal observation. I don't know of any data, but in general, people are wearing the mask.
Mhm. Okay. And I'm assuming the wash your hands and stay 6 feet apart. Why do these things work?
Well, the washing. Well, let me take the 6 feet apart distance. We know that this virus is spread by the respiratory route. That means that people cough or sneeze or laugh or sing, and if they have virus in their throat, it comes out into the air. When you cough and sneeze, you sneeze out droplets of saliva, and although we don't tend to see them, they're pretty small, but they vary in size. The small particles can be relatively large or relatively small or very, very tiny. And if they're relatively large, now that's relatively speaking, they tend to fall to the ground rather quickly from the air. And usually they fall to the ground within about 6 feet. But more recently, it's been shown, and it's clear now that some of those tiny droplets are so small, and they have a virus in them. They might evaporate in the air, and the virus floats in the air, and therefore it's airborne. And if you're in a closed space, not wearing a mask, like in your home, and you have poor ventilation, not poor ventilation, but you don't have a lot of ventilation, especially wintertime, and somebody who is infected is in that environment, then even if you're 6 feet apart, you might become infected. So the answer is, yeah, keep your 6 feet distance because somebody might cough those droplets, but at the same time, wear the mask because you might be in an environment where there is airborne spread or airborne, where the air keeps the virus suspended. Now, washing hands, there was initially a lot of concern about surfaces and how long would the virus survive on different surfaces. And if you touch those surfaces and then touched your nose, would you infect yourself? Um, it is a concern, but it's been shown now that it's pretty rare that you don't usually get the virus that way. You get the virus by being close to somebody who's coughed, sneezed, laughed, and put the virus in the air. So although there are a lot of places where you can wash your hands when you come into the store, you use a gel. When you come into the store, wash your hands at home. There's always a good practice, but it's probably less important as a way in which this virus is spread.
Okay. We're well into the second year of this pandemic, and the pandemic has been very impactful in the United States. Is that true in Canada?
Yeah, absolutely. It's had a huge impact. It's very similar to the United States. There's been an impact, disproportionate impact on disadvantaged populations. There's a disproportionate impact on mothers because we closed down our schools, and mothers here are often employed. They have to stay home to take care of their children, so they have employment issues and income issues because they're not going out to work and earning the money. We've had impacts on travel. I mean, it just goes on and on and on. There are impacts on small business. There are small businesses and restaurants that are not going to recover and will be permanently closed. So, yeah, the impact has been widespread here in Canada as elsewhere.
Did you close down movies and theaters and restaurants and bars and etc.?
Yes, we did. Movies have been pretty much closed the whole time, but the restaurants have been up and down, as I said, and bars up and down. Sometimes we allowed restaurants to open for inside dining, but with separation of tables, or you can open them up on the patio with separation of tables, and then we close them back down again, and so forth. So the impact on the service industry has been huge. Oh, and I can mention personal services like barbers and hairdressers and all those people have had an disproportionate impact.
Are they still closed?
They are now in various parts of the country, but not uniformly across the country. Um, there are concerns, for example, for our province of Alberta, where they've been resistant to having strict controls. And their cases are going up. dramatically. On the other hand, in Quebec, where they've had a curfew in place since October of last year, the cases have come back down again. Ontario, we had a lot of measures put in place, serious measures put in place at the beginning of January. The cases rose to a peak at the end of January. Then they came plummeting back down. And then they said, no, let's loosen up. And then back up they went again. And we're coming back down under strict public health measures. Vaccination has helped, but we still need these measures to control the virus.
Years ago, you would have been managing this whole thing, the response. What about now compared to when you were in charge?
Different. Well, this is back, I think, in SARS 2003. I was the federal manager for the outbreak. That meant coordinating with all the jurisdictions across the country, as I said, that are quite independent. But SARS was a different disease, a coronavirus, but a different coronavirus. And it was basically a hospital spread infection. It did not do well in the community. It did not spread widely in the community at large. So in a sense, although it was a difficult time, especially for the city of Toronto, where it was widespread, it was not anywhere near the same magnitude as this national epidemic or pandemic that's just is everywhere in the country, So managing the current problem would have been a lot more challenging, I can tell you that, than it was in 2003.
We're pleased to have the former Director General for the Center for Emergency Preparedness and Response in the Public Health Agency of Canada, Dr. Ronald St John, and we're talking about COVID in Canada and beyond, and we're going to get into some other countries pretty soon. But for now, can you tell me, Dr. St. John, what we can anticipate at the end of 2021?
Well, there will be a couple of issues. Number one, the virus will still be raging all over the middle income and lower income countries of the world. They won't be vaccinated. They won't have that much access to vaccine. So the virus will still be a global problem. Number two, assuming that there is some degree of control of the virus, for example, here in Canada through vaccination, there will still be a certain number of people, we don't know how many, who will not be vaccinated, either because they refuse or they have some condition that precludes them being vaccinated. They will remain susceptible. As a result, we think that a lot of people think, and I concur, that what we will have is outbreaks. We will have sudden places where there will be a clustering of cases, 10 cases, 20, 100, who knows. And those outbreaks will have to be put out by the public health authorities. But this will go on for some time. There's a big question: will there be another wave of this virus in the wintertime of the coming year? Who knows? It's a possibility. So we will, even if we vaccinate a large percentage of our populations, we aren't going to be totally out of the woods.
Are the vaccines going to save us then?
Well, the vaccines are going to be a big help. And they will do what they have been designed to do. It's clear they do stop serious illness. And because they reduce serious illness, they reduce death. Now, however, and there's been some question about whether or not a vaccinated person could actually become infected and spread the disease without symptoms. Probably not. There's accumulating data that shows that where you have introduced the vaccine in large numbers, the transmission of the virus, the number of new cases goes down. But no vaccine is 100% effective. There are people who, for a variety of reasons, have a weak response to a vaccine and might remain susceptible to infection. There might be mutations in the virus that will make it resistant to the vaccination. We don't, I mean, it's possible. That hasn't happened yet, but it's possible. There are cases where people have had been infected even though they're vaccinated because of a mismatch of their immune system with the virus or whatever. So the vaccine is an extremely important public health tool and a public health measure, but it is not the be all and end all.
Are there countries planning on having everybody, 100% of their population vaccinated by the end of the year?
Well, all countries, I mean, all the countries that have access to vaccine would like to do that. And that is a goal, but you'll never get 100% of any population vaccinated. Hopefully you can get 75, 80% of the people vaccinated, but that'll still leave, 20% of the people who are susceptible to the virus. So it just basically says the virus isn't going to go away completely.
How safe is the vaccine?
Well, so far the safety of the vaccines currently in use has been exceptional. There are systems in place to monitor safety issues after a vaccine is introduced into a population to look for rare events. Everybody, I think, is pretty aware of the blood clot issue following vaccination as a very rare event. And yeah, I mean, there are rare things that will happen once you expose millions of people to a drug or a vaccine. I mean, people sometimes forget that there are side effects associated with Tylenol or aspirin, which almost everybody takes. But they're rare. They're rare. And so you balance the risk of a serious side effect against the benefit. And so far, and I think this will hold, the benefits far outweigh the risk.
Do you believe that we're going to need a shot of vaccine every year?
Good. That's a $1 million question, Ardith. We don't know how long the immunity will last. We don't know how long the immunity or how strong the immunity will be after just the natural infection. We know that people who get the natural infection do develop antibodies, immunity to the next infection. But we also know that people who have very mild illness have weaker antibodies than people who have serious illness, and their antibodies last longer. The vaccine, with one dose or two doses, creates a strong immunity, but we've only been able to observe that immunity for about 6 or 8 months, 6 months really. So it's hard to know what that immunity will look like 12 months, 24 months, 36 months from now. We can only measure it over time, and time will tell whether we need another booster dose.
Dr. St. John co-founded a company called Citata, which is a travel risk management company. So every day he studies countries around the world. How does Canada compare to the US?
In terms of COVID?
Yes.
Yeah. Well, we have a smaller population, so we have a lot fewer cases. I think initially in the United States, when the virus was expanding exponentially, and the number of new cases per day was in the tens of thousands, that was a much higher rate than in Canada. However, interestingly enough, if you look at a certain province by province in Alberta right now, because of the lack of strong public health measures, the per capita number of cases is greater than it was in the United States on a per capita basis. So it varies a lot from place to place and jurisdiction to jurisdiction. We just had, because we have a smaller population that's spread out widely, we had a slightly smaller problem than I think the US had.
How would you compare the way that Canada has has reacted or done with this virus to the rest of the world?
Well, again, I think it's probably a C plus. If you look at the United Kingdom, they have done a better job, and not necessarily during the prevention, but they've done a much better job in terms of getting the vaccines out to people. And their number of cases and the number of deaths has just plummeted. Um, but then, Germany is back into a lockdown position because they let everything loose too soon, and they're back into a lockdown position. Um, and then, if you look at the tragedy that's going on in India, well,
Yeah.
Canada fared much better. It's fared much better than India. But I guess it probably, if you look at the wealthier countries who've had to cope with the outbreak, Canada is probably in the middle of the road. I don't think we were the best of it. If you really want to look at the best, you can look at Australia, New Zealand, Vietnam, Australia, but Australia and New Zealand are sort of islands, and it's a lot easier for them to deal with this virus than it is for other countries.
They still have a lot of travelers, though.
Well, Australia, if you're an Australian, you can't come home, which is rather radical to deny your citizens access to the home country. They shut down. They shut down everything. They shut it down for, their cities, their economy, everything for 4 months. And they drove the cases down to about 10 a day. In the city of Perth the other day, the last week, I guess it was, there were 2 cases that showed up, and in a flash, they shut down the entire city for 2 cases. And so they can make sure that there's no spread. New Zealand, they can absolutely control the entry of people. You have to stay in a hotel for 14 days before you can actually leave quarantine, and they have no cases. But then again, it's only 4 million people, and it's an island, so that's a lot easier.
Well, now Vietnam isn't an island. What did they do?
Well, Vietnam is interesting, an interesting study. When the first cases were reported in Wuhan, China, Vietnam, which is northern border, is a border with China, they immediately closed their border and stopped all traffic between China and Vietnam immediately before they had any cases in Vietnam. And they made preparations. Now it's a more autocratic government. So when they said people should wear a mask, everybody wears a mask. And wearing a mask in Southeast Asia is much more traditional than it is in Western culture. So during flu season, it's often you find a lot of people wearing masks in Southeast Asia. So they were able to stop all traffic coming in. They were able to control airplanes and so forth. So they had very little spread until recently. They've had a couple of outbreaks that they've been able to respond to, but nowhere near the problem that some of the Western countries have had.
Do we know why India has been so bad?
Well, there's a lot of speculation about India, but there are probably many factors that contributed to it. First of all, when the virus first surfaced, it was detected in India. This is way back last year. But the initial wave was quite small in India for reasons that are not clear. And I think India and its leaders felt they dodged a bullet, that it wasn't going to spread in India. And then during the summer months, India has many, many large festivals where huge numbers of people come together, and then they disperse across the country. So that's one of the best ways of spreading a respiratory disease. So after all these festivals and the lack of any major public health measures, and the idea that, well, maybe we are okay in India, that set the stage for the virus to spread widely and literally take off. And this is what it has done. And I think now they're chasing the virus, so to speak, trying to get control of it, and having a difficult time.
We have in the United States anti-vaxxers, people who say, I'm never going to get a vaccine. Do you have that in Canada?
We do. Yes, we do. Um, we tend to think of three groups of people: the people that accept the vaccine, the people that are hesitant about it, means they're not against it, they're not for it, they're just a little worried that maybe it's not the right thing to do. And then we have the actual deniers that the vaccine should be taken. A relatively small group, I mean, relatively speaking, but very vocal and very capable of using misinformation to support their position.
Dr. St. John, you've made us lots smarter. We've done some world travel in the safest manner possible. And thank you for joining us. This is Ardith Keck for Forum 360.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.